For our Learning Circle discussion presentation, we have chosen the topic housing and migration. This group consists of Yasser, Michaela, Kyra, Lucas, and Fabian. Before we talk about our intervention, we should talk about the history about migration and health. Did you know an estimated 214 million people move internationally and relatively 3/4 of a billion people move within their own country? Human migration is commonplace in its impact on globalization and health policies. Bureaucracy and migration health is administered within policy sector silos, or for example, immigration, trade, and labor. Decision makers need to adjust cross-border and policy sectors. Some threats on health policy dates back to medieval times. Quarantine, disease control, and prioritized public health recommendations rely on monitoring and screening, for example, the pandemic flu. We are seeing that right now too in today's times, and if it has happened in the past, it will definitely happen in the future. To continue, the outbreaks of typhoid fever and tuberculosis in the 19th century dramatically changed society's perspective of health. Increased sanitization, ventilation, and limited household crowding were all seen as factors to reduce the spread of these infectious diseases. Hence, housing and buildings were significantly overhauled since the onset of the Industrial Revolution, including indoor plumbing. However, these interventions focus largely on the spread of communicable diseases. Interventions today are fixated on chronic diagnosis, including asthma.
Housing and migration is a social determinant of health with three main but intersecting constructs: adequate housing conditions, affordability, and residential stability. Housing policies influencing where people live, the stability of their housing, and the quality of that housing provide context to understanding a plethora of social and economic risk factors. These factors, we now know, influence chronic health conditions and contribute to significant disease burden and death. Poor housing quality and instability have been associated with numerous physical health conditions and accidents and injuries as a result of structural deficiencies. Housing conditions are tied to economic factors, as vulnerable populations are more prone to insecure housing settlements, health consequences related to poor housing conditions, residential instability, and unaffordable housing expenses. Housing and migration is closely related to low social instability, which by itself predisposes to malnutrition, lack of access to affordable health care, and poor health. High housing costs that are a huge proportion of a family's income may also cause some families to make critical trade-offs. Residents of overcrowded homes may be at risk for poor mental health and food insecurity. Researchers show that individuals with housing instability have limited access to health care. Inadequate plumbing in homes may also impact health. Corroded plumbing infrastructure in Flint, Michigan, for example, increases residents' exposure to lead.
The migration phases framework can be broken up into 5 stages. The first being the pre-departure stage. The pre-departure stage is the period before an individual leaves their place of origin, and policy efforts are focused on screening for communicable diseases. The second is the travel phase. The travel phase is the period between place of origin and the destination location. This is where pathogens may be carried out across different areas. The third is the destination phase. This is where individuals settle for a piece of time in their locations, and policy becomes more focused on issues such as income, socioeconomic influences, diseases, and mental health. The fourth is the interception phase. This applies to small and at-risk groups, relevant to forced migrants as they experience temporary detention or interim residence. It may affect their mental and physical health because of the conditions. The last is the return phase. Individuals settle back into their place of origin, and people might experience the migration exposures on their physical and psychological well-beings. The importance of migration phases framework is twofold. One being policymaking, which can lead to more comprehensive and cooperative decisions among the stakeholders of the world. This will promote collaboration and reduce division. The other is inclusivity, Understanding the various phases of migration will allow individuals to become more knowledgeable about migration and even more supportive of equitable policies to foster accessible care for migrants.
The intervention our group specifically chose was the Advancing Safe and Healthy Homes Initiative, also known as ASHE, which was launched by the Kresge Foundation in 2009. The program seeks to eliminate home health hazards, including poor carpeting, asthma triggering allergens like asbestos, low quality insulation, and fire hazards. By doing this, the program also aims to enlarge government capacity in order to support those living in inadequate housing and to make sure that the incidence of preventable illnesses and hospitalizations resulting from this inadequate housing can be kept under control. Through the implementation of ASHE, we can improve the health outcomes for those living with inadequate housing conditions. And in order to relate it to our local aspect, the foundation did award 6 grants in 2012, one of which was given to Detroit. What separates the ASHE intervention from other interventions focused on housing and migration is its emphasis on the stakeholders in the process as well as its focus on systematic change. This is accomplished through framing the message to the public and empowering individuals to understand what the actual problem is faced by those living in inadequate housing conditions and how this relates back to the social determinants of health and poor health outcomes. By doing this, ASHE seeks to mobilize community efforts, which can come in the form of advocating to government representatives or joining local activist groups in order to enact change. In essence, ASHE seeks to mobilize the community in order to make an impact. ASHE also relates to the social determinants of health, including health and healthcare, the neighborhood and the built environment, and economic stability. In terms of health, by reducing health hazards in the home environment, chronic conditions like asthma can be prevented, and the reduction of costs for primary care physician visits, urgent care, or even emergency department visits can be lowered. Relating back to economic stability, by reducing these costs for these healthcare visits, families can have more access to their income and be able to spend their income on other items and goods other than healthcare costs, which are unnecessary in many cases, including trips to the ED for asthma. Additionally, in terms of the neighborhood and the built environment, having access to a healthy home has been shown to increase the appeal of a neighborhood, and this also promotes increased mental health. For instance, parents will have more time to spend with their children in terms of not having to worry about paying bills or worrying about chronic conditions, including asthma checkup visits.
This is a supplemental video you guys can check out that gives a general idea of the goals and activities of ASHE. The course concept that we thought best correlates with our intervention is a life course theory, and this graphic highlights the 5 principles that this theory consists of. The life course theory emphasizes how our experiences and surroundings impact our health over a course of the lifetime. And the 3 principles we identified that applies with ASHE, our intervention, is timing, lifespan development, and linked lives. First, with timing, our intervention especially focuses on people at vulnerable ages, like children and the elderly, that are in critical periods in relation to their health. For example, addressing lead and toxins in homes to prevent brain damage for kids, or fixing water leaks, ventilation issues, and controlling pests to stop asthma from escalating. ASHE also improves homes to make them elderly friendly as well. For example, strengthening stairs or adding handles for grip and stability. Second, lifespan development. ASHE is attempting to improve quality of life before chronic damage is done, which can change the trajectory of one's life. This is seen, especially for kids, by striving to prevent things like brain damage and asthma, as mentioned before. This allows kids to go to school and learn better when there isn't much to worry about at home, which eliminates stress and maximizes their performance at school. Lastly, the principle that applies is linked lives, which is ASHE is trying to strengthen lives by expanding the networks of shared relationships to those who need it by requiring different organizations to participate and strengthening the community overall. In conclusion, we want to stress that migration influences the health of individuals and populations on a global scale. This requires interventions to identify the migration status of individuals and target each stage of the migration process and reach across borders to make migration safe and healthy for all. And in regards to housing, improved housing generally leads to healthier outcomes. And ASHI is successful in doing this by providing healthy houses for not only those in the present, but to break the domino effect and better the future of coming generations. Thank you.